Hello, my name is Dr. Arandi. I'm assistant professor in psychiatry at النجاح University in Palestine. Today I will speak about ED, erectile dysfunction. As we know, we have many sexual disorders. One of them is there are many subclassifications for disorders which is regarding to erectile dysfunction, lack of libido, and premature ejaculation, and placebo, which is the feeling of convulsion after sexual intercourse. With regarding to erectile dysfunction, it is defined as the man cannot develop or maintaining an erection for sexual interaction. This can be happening for everyone in his life, but if it is continue for a period of 3 months with recurrent failure, about 75% from his attempt, and it affect his general health and affect his psychiatric feeling, and if he feel after that he is depressed, disappointment, and feeling of guilt feeling, and even feel sad and depressed, which is called sexual depression. This is called it is sexual or erectile dysfunction. Erectile dysfunction, in prevalence, it is about 1 for every 5 persons. Erectile dysfunction, it is became more increasing in incidence as the age is increased. There are many factors which affect actually or the etiology of erectile dysfunction. There is organic causes and there is psychological causes. With regarding to the organic causes, there are multiple, which include heart disease, cardiovascular disease, hypertension, diabetes, hormonal imbalances like testosterone and prolactin and others. There are some nerve diseases, nervous system diseases like dementia, multiple sclerosis, Parkinson diseases, disease of the testis, also disease of the pituitary gland, and with a thyroid disorder or lipid profile causes what erectile dysfunction. Some drugs can have side effects which affect the erection, such as painkiller, antihistaminic, and major atypical antipsychotic drugs can give metabolic syndrome, which increase prolactin, which affect the fertility and the erection. Selective serotonin reuptake inhibitors has serotonin or sexual syndrome, which is a side effects of some types of selective antidepressant drug with selective serotonin reuptake inhibitors. Let us move to the psychological causes. Actually, stress is a main factor which causes erectile dysfunction. Anxiety, performance anxiety, sometimes stress related to the honeymoon environment, marital and family problems, and exhausting in the work, which give stress. Or psychological factor play an important role. It is about 20% take the etiology, 80% from the organic causes, which causes erectile dysfunction, psychological causes make 20% from these causes. 10% related to how do we feel and how do we think about sex can affect the erection actually. With regarding to the risk factor, there is a lot of risk factors which affect the erectile dysfunction. One of the major of them is the obesity. Obesity can play important factor about the erection and disorder of erection. As we know, obesity can lowering the testosterone level. Also dealing with drug, excessive alcohol, excessive beer consumption, drug, narcotic drugs can lead to erectile dysfunction. Another, with regarding to the psychological factor, as we said, stress and anxiety, performance anxiety, depression, and marital and family problems and work problems make you stress and affect your environment. Most common of the erectile dysfunction accompanied by lack of libido. Lack of libido, there is no power or libido or wishing for or feeling towards sex. It causes erectile dysfunction. Let us go to the treatment, the investigation. There is a lot of investigation to discover or knowing the etiology, especially the latent or mask causes. We can do double ultrasound for the penis. We can do test for glucose, for triglycerides and other lipids, for testosterone, for prolactin. We can do what is known as a home test. Home test, this is very important. As we know, in sleep we have non-sleep and REM sleep stages. In rapid non-REM sleep and REM sleep, there is an erection occurs 5 to 4 times during the sleeping. The main point in this category that when we taking the history, we can ask the person if he has any erection after waking. If there is an erection, we know it is psychological causes and not it is organic causes. About treatment actually. Treatment, it is biopsychosocial and rehabilitation treatment. From the biological point of view, before of that, of course, we do a physical examination. We examine the genitalia. We examine if there is any trauma or any irregularity in the venous or arterial supply, the size of the testicles, the shape, the abdomen, all of the genitalia. It is very important with the history. With regarding to the management, as I said, it is biopsychosocial and rehabilitation treatment. From the biological science point of view, we have many drugs which add for erection. It includes Viagra, Cialis, Talidophine, and others. And there is sometimes we use, but it is not approved by the AFD. It can we use trazodone actually, and we be precautious. Trazodone can give priapism. We can use it for sometimes with cautious to get erection. Yohimbine, it is very important, and it was used a lot in the past. Actually, it is safe drug and give good result. Sometimes we ask about what is the difference between Viagra and Cialis. Viagra can be presented by 50 to 8 milligram, and there is 100 milligram. Cialis can be found 20, can be found 5 milligram. Viagra can, both of them we can give them, we should give them before the sexual intercourse. For Viagra, it should be 1 hour. It is matter 1 or 2 hours in case of Cialis. The half-lifetime of Viagra is 4 hours. The half-life of Cialis is 36 hours. The main issue between them, can we give Cialis as a course of treatment for 2 weeks, actually, every night or every day, but both of them, we should note that it is not act without sexual stimulation. So if we give them as a protocol of course of treatment, we should avoid sexual stimulation. About the psychotherapy, I think education, psychosexual education is very important. There is a lot of cases when we see them, and as we know, sexual psychotherapy, it should join both the couples. You can't give psychotherapy, sexual psychotherapy in one of the couples. It should be for both. There is a lot of sessions which started by giving some physiological or anatomical explanation, physiological stages of sexual intercourse. As we know, it is 4 stages: about libido, about how do we feel, about what is the irritation and excitement, which give to erection in the men and lubrication in the female. After that, the ejaculation and the tremors or chills after that, which is very important. Many cases of erectile dysfunction, it is accompanied by a lack of libido. The psychotherapist, sexual psychotherapy, it is, as I said, it is many sessions started by general MAB sensation. It is run more 1-2 weeks without any sexual activity, just as to discover the sensitive area in both male and female, where they are feeling excited. Both of them concentrated what area that excited them. We move to focusing the sensation, and then we go to start-stop method. As we know, it is permit for playing for both, and when there is erection, we stop erection by squeezing in the top of the penis for not ejaculation. In this way, we encourage them, we make them feel comfortable, not afraid from the failure. After that, we permit for sexual intercourse, and there is a lot of postures how to do this. And the most famous one for those who have erectile dysfunction is woman above position. This is make relax for both. Regarding to the social treatment, you know, social treatment is very important. Changing overall lifestyle, it is important. Encourage communication for both the husband and the wife. teaching them how to clue for invitation for sexual intercourse or for social meeting, preparing the environment is very important, and going to dieting, not increasing in weight, obesity, can lowering sexual testosterone and can interfering with good communication with the wife. Sport is very important. Sport in logic manner and healthy manner. It is improving our spirit and our activity and our hormonal balance inside. Sometimes we precautious about plastic cups, plastic bottles could be lowering the testosterone. With regarding to the diet, and there is a lot of thoughts about some types of fruit, vegetables, and others, and other food which can improving our health. But it is, as you know, there is no statistical reference for this, including watermelon. It is improving the quantity of water in the body and can improving the circulation in the penis. Lemon, it is very important. Banana, it is important. Crafts, it is a vegetable. Cacao, it is can giving good enhancement for these sex libido and erection. Many sports which are building heavy building sports, and there is a lot of sportmen who is established or running in a routine, increasing protein, taking some food which maybe has side effect in lowering the testosterone. Bicycle driving, if it is excess, not healthy driving, can lowering the testosterone. However, good relationship between the parents or the marital couples, it is very important. It can encourage both of them, discussing between them the problem, and they can govern themselves. Always think that female is responsible for her excitement for her husband. Thank you very much for your listening.